In 2020, as the country wrestled with an unfolding pandemic, political divisions, social isolation and unrest, and economic disruption, gun violence in the United States surged. That year saw the highest number of gun-related deaths ever recorded by the Centers for Disease Control and Prevention, along with a sharp increase in gun homicides. Today, we will hear from members of the Johns Hopkins Center for Gun Violence Solutions, who authored the report that illustrates striking differences in gun violence across demographic and state-level geographic areas. We will focus on the landscape of gun violence, the importance of data collection, the disparities, state policy implementation efforts and recommendations. And we will hear from Cities United on the equity concerns and the disproportionate burden of gun violence on Black men and boys. The data is alarming, and it is critically important to remember that this data represents a member of our national community, a daughter, a son, a brother, sister, mother, aunt, uncle, a member of our national community. We will get a better understanding of the data. Why the increase? COVID, expanded gun carrying laws, perhaps gun sales? What about the impacts of structural, social, and economic determinants? What about how we reimagine public safety? Or how about we address the challenges of state versus federal policy? We will transition to Q&A, and we've allotted significant time for discussion and hope that you will place your questions in the Q&A. We're here today not only to discuss the findings, but to lift opportunities for change, as well as potential solutions that include policy, as well as community-level interventions. You are here today not only to listen, but to offer your voice, your expertise, your vision for a future where death by guns is reduced or eliminated. You represent academic institutions, government agencies, partner organizations, and legislators. You are here because of your commitment and interest in a better way forward as it relates to gun violence. I should have noted, my name is Michelle Spencer. I'm a faculty member here at the Johns Hopkins Bloomberg School of Public Health in the Department of Health Policy and Management. And it is my pleasure to be with you this afternoon for this important discussion. Joining me are Ari Davis. Ari is a policy advisor with the Center for Gun Violence Solutions. He's a Doctor of Public Health candidate at the school. He conducts research and advocates for evidence-based policies to reduce gun violence. Dr. Cass Krafasi is an associate professor of health policy and management, also at the Bloomberg School of Public Health. She's the deputy director of the Center for Gun Violence Solutions. Her research focuses broadly on public safety, including injury epidemiology and prevention, gun violence and policy, attitudes and behaviors of gun owners, and underground gun markets. Quiniqua Carthan-Love is the deputy director at Cities United, a strategist and social worker who focuses on the liberation of Black communities with an emphasis on eradicating the epidemic of community violence, celebrating Pan-African history, and exploring the intersection of racism, community violence, and social change. And Lisa Galler, who serves as the State Affairs Advisor at the Johns Hopkins Center for Gun Violence Solutions, who focuses on research, advocacy, and implementation of evidence-based gun violence prevention policies, including extreme risk protection orders and domestic violence protective orders. We will hear first from Ari, who will do an introduction and give us an introduction of the main findings followed by Cass, then followed by Quiniqua, and finally, Lisa. We will then open for a spirited discussion, again led by many of you in our audience. And I ask again that you please put your questions in the Q&A. So I'll turn it over to you now, Ari. Thank you.
Great. Thanks, Professor Spencer, for that great introduction. So I'm excited to discuss this new report with you all, and I'm going to share some top-line findings. But before I do, just a little background. So this is looking at 2020 gun death data from the CDC. The data is from death certificates, looking at the cause of death. And so what we did in this report is really looking at who's impacted by what types of gun violence, where that's happening in this country. And then really we went into the weeds and broke it down to really kind of understand the scope of this problem. Before I jump into kind of the top 5 facts, I just wanted to reiterate a point that Professor Spencer made, is that, often we're going to be talking about big numbers here, but each number, each data point is a life. And I think it's just important to keep that in mind as we have this discussion. The other point I wanted to mention is that this report is solely focused on fatalities, so on deaths. We know that the impacts of gun violence are far greater than just the deaths. We know that for every death, multiple people are shot and injured, often facing lifelong trauma and injury from that. And we know that dozens more are impacted by the trauma of witnessing a shooting or knowing someone who has been shot. And then it goes even broader than that, right? We know that entire communities, some folks may live in fear of leaving their home or going to school or walking to the store. And in some households, folks may be in fear that their partner who has a gun and threatens them with a gun, they may be in constant fear. So again, the impact, the public health impact of gun violence is so much broader than what we're going to be talking about today. However, the data we're talking about today is super important to develop policy solutions and really understand kind of the scope of gun deaths in America. So I'm going to share my screen real quick and just talk about 5 quick stats that were kind of the top line from this report. So in 2020, we saw the highest number of gun deaths ever recorded in the US. So 222 people lost their lives. And we saw a massive 1-year increase. So gun deaths overall increased by 15% from 2019 to 2020. And firearm homicides spiked by 35%. And suicides, while they didn't spike from 2019 to 2020, they remain at a decade's high for the last 3 or 4 years. So this is clear that we're in the midst of a crisis of gun violence. So when we started looking at different demographics and populations, we saw that Black Americans are disproportionately impacted by gun homicide. Particularly Black men, young Black men, are 20 times more likely to be a victim of gun homicide than young white men. And that population of young Black men make up 2% of the overall US population, but they accounted for 38% of all gun deaths or gun homicides in 2020. So we know that this is a racial justice issue. This is a health equity issue. If we want to be reducing health disparities, we should be addressing gun violence. We also looked at age. So we found that among children, teens, and young adults under the age of 25, gun violence is the leading cause of death. So that means more children and young adults died by guns in 2020 than by cancer, than by car crashes or overdose. And we even looked at COVID in 2020, and we saw that among young people were nearly 10 times more likely to die by a firearm than COVID. And these comparisons are meant to just illustrate just the burden that this has on our children and our future in this country. And we invest massive amounts of money and research and solutions to other leading causes of death. And this is just meant to illustrate that we should be doing the same for a leading killer of our youth. We also looked at state variation, and we found that there's actually a wide variation in gun death rates across states. We found that states with strong gun laws tended to have lower rates of gun violence. And then states with weak gun laws tended to have higher rates of gun violence. So for example, Mississippi had the highest rate of gun violence in 2020, and Hawaii had the lowest. And so someone living in Mississippi was 8.5 times more likely to die by a gun than someone living in Hawaii. So again, this illustrates that there are policy solutions out there. There are programmatic and interventions that can work to reduce gun violence. And we know that some states are passing policies and taking efforts to reduce gun violence. So those are the top, some of the top findings. But I'm going to pass it over to Dr. Krafasi to dive more into the nuance of this report. Thanks so much.
Yeah, thanks, Ari, for that great overview of some of our key findings. And I'm going to just chat with you and go into a little bit more detail on the distribution of firearm deaths that we saw in 2020. So as Ari mentioned, there were over 45,000 deaths. And when we break this down by intent, about 54% were the result of suicide and 43% were from homicide. So in prior years, the distribution put gun suicides at closer to 2/3, or at least more than 60%. It is lower, that proportion is lower in 2020, but not because there were fewer gun suicides. To the contrary, 2020 was only the second time we've ever seen more than 24,000 gun suicides. 2020 was unique in the distribution of gun deaths because of the substantial increases in gun homicides that were previously discussed. Firearms are exceptionally lethal. Nearly 80% of all homicides were committed with a firearm in 2020, and that's up by over 10% from 2011. Just to put these numbers in a little bit of perspective, guns were associated with more deaths than motor vehicles in 2020. And this is despite the fact that most people in the US probably see a car every day, but only about 1/3 of households own a firearm. So we also know that gun deaths are not distributed equally across the US, and 2020 was no different. 85% of those dying from firearm homicide were male, and Black Americans experienced exceptionally high rates of gun homicide. Black men were 15 times more likely to die from gun homicide than white men. Black females were 5 times more likely to die from a gun homicide than their white counterparts. Alarmingly, Black females experienced a 49% increase in gun homicide compared to 2019. And this is the largest increase we saw among any demographic group. Like with homicide, men experience higher rates of firearm suicide, and they accounted for 87% in 2020. White males account for about 30% of the US population, but more than 70% of all firearm suicides. Firearm suicide is consistently higher among white men. However, there have been distressing increases in firearm suicide among young Black Americans, with rates doubling or nearly doubling for those ages 15 to 24 over the last 10 years. Importantly, American Indian and Alaska Native men had the highest rate of firearm suicide at over 15 per 100,000. But given the incomplete and inconsistent reporting among this demographic group, this is likely an undercount of the true burden. We also know that there are geographic differences in gun deaths. Rural counties experience substantially higher rates of firearm suicide, and urban counties have slightly higher rates of firearm homicide. Contrary to what we hear in the media, it's not always places like Baltimore, Maryland, or Chicago, Illinois that are solely responsible for our high rates of gun deaths. Some of the places with the highest rates of gun deaths aren't where you'd think. And to the point Ari raised earlier, places with weaker gun laws tend to have higher rates of gun deaths. For example, Ari mentioned Mississippi, but you can add Louisiana and Wyoming among the states with the highest rates of gun deaths at over 25 per 100,000, while New Jersey, Massachusetts, and Hawaii all have the lowest rates at around 6 per 100,000. There are many questions about what's driving our increasing rates of gun deaths. It's not just one thing. All the structural, social, and economic factors and determinants of health that contributed to violence didn't go away when the pandemic hit. In many instances, these factors were exacerbated. You add on top of that protests resulting from mask mandates and social distancing requirements, record-breaking numbers of gun sales, misinformation about the election and the insurrection at the US Capitol, the expansion of stand your ground laws that allow civilians to use deadly force without the duty to retreat, and the removal of training, background check, and licensing requirements for the concealed carry of firearms in public. All these factors, as well as others, likely contributed in some way to the increases we saw in 2020. Just like there's no one thing responsible for the gun deaths in 2020, there's no quick fix. There's no one thing that we can do to solve the problem, but solutions do exist. We need to take a public health-oriented, multifaceted approach to both understanding and addressing the issue. So I've outlined some of the data from our report. I'm happy to talk about this more during the discussion, but as was raised previously, it's so important that we keep in mind these numbers are people with family, friends, and community. And with that, I'm so excited to turn it over to Quaniqua from Cities United to share her insights and perspectives on this issue.
Thank you, Cass. And well, thank you everyone for the invitation on behalf of Cities United for being here and joining you all today. And equally, I just want to thank you all as well for really uplifting those inequities, right, as well. It's always a pleasure, unfortunately, to get on some of these calls and webinars and actually hear people speaking about it, right, and calling out those inequities that exist. So thank you. As Cass said, my name is Quaniqua Carthan Love, and I have the honor and pleasure of serving as the Deputy Director at Cities United. At Cities United, we support a network of over 130 cities who have committed to saying yes to safe, healthy, and hopeful communities by really addressing this issue that we're talking about today. And that's the disproportionality within homicides and shooting deaths of young Black men and boys. Since Cities United has been in creation, we celebrated our 10th anniversary last year. And since we've been around, we've been working really diligently with mayors, right, and their teams, other city representatives, young leaders 18 to 24, and community-based partners who really do that work on the ground of interrupting violence as it happens and before it happens, really de-escalating, right, those situations. But one of the beautiful things about the Cities United Network is that it brings together individuals with lived experiences, right? Individuals who have family members who have died due to homicides, individuals who have been shot themselves, right? And we are all on a collective mission, right, to really eradicate homicides and shooting deaths of young Black men and boys. When we first started back in 2011, it was 14, right? That was the number, unfortunate, awful, right, number that we really brought our network around. And that was 14 young Black men and boys were dying every single day, homicide, right? Imagine, right, 14. It may not seem like a large number, but it's a big gap at the Thanksgiving table, right? It's huge when it comes to having somebody to walk you back and forth to school. 14 may not seem like a large number, but it is to all of the families, right, the communities, and all of that lost potential to not just those families and those individuals, but to our country as a whole, right? So Cities United has worked with, as mentioned, over 130 cities to really get a better sense of what's happening and how do we address it. In the early days of Cities United, we really hit home on three kind of key things, right? As what you all already mentioned, and Cass and Ari talked about those structural, interpersonal, internalized, right, forms of racism, as we call it out very clearly, that have contributed to a lot of the disproportionalities that we see in homicide shootings. Right, calling those out, what can we actually do with that? How do we make a shift, right? And what we do a lot and talk through at Cities United first are those mental models that create those conditions. So how do we actually address those? Address those historical disinvestments in Black communities that lead to poor conditions, such as education, low education rates, the gap, right, when it comes to affordable housing and home ownership, the things that exist that make it a little bit harder for Black and Brown communities alike to really move the needle forward and reduce this number. And then one of the other big things that we do here at Cities United is really looking at those traditional methods of criminal justice, right? What can we shift? How can we reimagine public safety? Which leads to, I'm gonna share a graphic real quick with you all, a graphic that I'm gonna share that really Cities United, we created after 2020, right? So last year, well, 2020, now 2 years ago, I rephrased. And this graphic really was helping us to answer this question. What does it mean to reimagine public safety? How do we do that? What does it include? And so as we think about the recent data that was just shared, as we talk about what was some of those root causes and how do we address them, Cities United thinks about that in three different ways. So we interrupt the cycle of community violence, so really hitting home with more of that interpersonal, right, and internalized, breaking those cycles. The second key thing is dismantling those systems of inequity. So as we look at the education system, the criminal and justice systems, how do we reshape those? And then lastly, one of the things that typically gets left out of some of these conversations is how do we invest in new operational and administrative systems that actually support the reduction of these deaths that we are talking about today? Because what got us here, of course, won't get us out. And so I encourage you all, as we keep having this conversation, to really lift up, right? How do we reimagine a public safety that looks like you and I, right? That is inclusive of community, that really takes into the considerations of those with lived experiences. And of course, overall, really focus on the safety, the health, but also the hope that exists in our communities. So again, thank you. My name is Quiniqua Carthen Love, and I serve as the Deputy Director here at Cities United, and I look forward to continuing this conversation.
Thank you to all the panelists that went before me. Before we get to the Q&A, I want to turn our attention to solutions. We're the Center for Gun Violence Solutions, so we want to make sure that we finish after giving an overview of the problem and some potential solutions, that we highlight the three recommendations that we made in the report, which you have in the chat and you can reference later. And I want to start by saying that gun violence is an incredibly complex problem. And in order to prevent it, we need a myriad of policy and programmatic solutions. So while we do highlight three in this report, that is not comprehensive. We know that there's other policies that we did not touch on in this report. So we encourage you to look at our website for more information about other solutions to prevent gun violence. But I will highlight the three that we talk about, the first being firearm purchaser licensing laws. These are a process that enhance the existing background check system by requiring an individual who seeks to purchase a firearm to complete an application process. Sometimes there's fingerprinting, a more thorough waiting period. Sometimes there's a live fire safety training course that goes with this licensing process. Only 9 states currently have a firearm licensing law, but we know that this is one of the most effective solutions to prevent not only homicides, but firearm suicides. And so our first recommendation is that states adopt a firearm purchasing licensing system to enhance the background check system in their state. If it's a universal background check system or not, it's very important that there is a firearm licensing law in place. Second, this is a two-part recommendation. We recommend that states adopt firearm removal laws, and those can be domestic violence protection orders and extreme risk protection orders. I will start with domestic violence protection orders. They may be something that the audience is more familiar with. They are court orders, civil, they can be criminal, but we're talking here about civil court orders that protect victims and survivors of domestic violence. And they work differently in the states that have them. Actually, all states have some form of a domestic violence protection order, but they vary significantly in the strengths of the protections offered. They can include no contact orders. They can include stay away orders for individuals experiencing domestic violence and the abusive partner, but they can also include provisions related to firearm relinquishment. So domestic violence protection orders, again, are not solely focused on firearms, but can include protections related to firearms. Extreme risk protection orders, however, which are also civil orders modeled off of domestic violence protection orders, they exist in 19 states and DC. They are solely focused on access to firearms. These are civil orders that require an individual at risk of violence, either towards self or others, from temporarily having access to a firearm. So this is a law that is a temporary firearm removal. There is typically an ex parte or temporary process that removes a firearm for, about a week or two. And then there's what we call a final order, which is usually lasts up to 1 year. These are, again, modeled off of domestic violence protection orders, but the important thing to note is that they are solely focused on access to a firearm, whereas domestic violence protection orders have a number of other protections. And finally, in the report, we talk about homicide review commissions and community violence intervention. These are focused, again, on community violence, specifically homicides that occur usually in cities. Homicide review commissions are this partnership between public health and public safety that allow for the analysis of trends in gun violence, allow community members to give their input and generate actions for how to prevent community violence in their communities. Again, there's more information on this in the report. I will just briefly touch on this before we get into some of the Q&A for the last 30 minutes or so. Community violence intervention are programs that aim to identify the usually relatively small group of individuals at risk of violence by helping them resolve conflict. There's going to be conflict resolution. There can be the recommendations of providing wraparound services, mental health services, social support to, again, this small group of individuals that are in certain cities responsible for a large majority of the gun violence that occurs. And so, again, just to reiterate, the recommendations in the report are that states adopt firearm purchaser licensing laws, also called permit to purchase, that states pass and implement domestic violence protection orders with strong firearm relinquishment provisions and extreme risk protection orders, and that states and cities and localities have homicide review commissions and community violence intervention programs. So I will turn it back over to our wonderful moderator, Professor Spencer, and we'll get to some of the questions that are in the chat.
Well, thanks, Lisa. Thanks, Cass, Ari, Quaniqua. Certainly, we have a number of questions that have already come in. Lisa, one of the last things you said in highlighting those 3 recommendations, that last one, that cities and states should have the Homicide Review Commission coupled with violence intervention. And I wonder if you can talk for just a moment, the importance of having that collaboration. So you have that 3rd recommendations have 2 components. And I wonder if you can just talk a little bit about the importance of both of those components in that 3rd recommendation.
Yeah, so actually, I might turn this, and not to put them on the spot, to Ari or Cass, who work more with the HRCs and CVIs than I do, if that's okay.
Perfect.
I don't know.
Sure, I'm happy to jump in. it's important that we have the individuals from communities that are impacted by violence having a hand in violence prevention efforts. And that is important where we have community-based organizations that can meet people where they are with credible messengers to provide supportive services, transitional housing, transitional jobs, all these kinds of things to help address the trauma, the reasons why an individual may be feeling like using a weapon to solve a dispute, sort of based on all of the trauma that they've been exposed to throughout their lives, sort of addressing some of these underlying issues and some of the structural and social and economic reasons and sort of environment in which these folks are in. Community-based violence prevention programs are really well equipped to do those kinds of pieces. But we also know that we need improved relationships between police and community. We need to be focused on the right kinds of policing. We need to be focusing on case closure for homicides and non-fatal shootings when an individual does commit a violent act or cause harm to someone else. We need to have some kind of accountability system, which could be restorative justice. It could be a more effective criminal legal system. But a homicide review commission is one way to improve that relationship. It's a data-driven process that identifies patterns. It gives a voice to community by involving them in case review, not simply going into a community and saying, we know what your problem is, here's a solution, but rather here's some data that we're seeing, help us understand these patterns, these trends, give us some context. And what are the other things that are occurring in your community? Broken street lights, broken windows, trash. What are the kinds of things that we need to be thinking about in terms of intervention that can help lift everyone and help improve some of these relationships so that everyone has a voice in co-creating solutions to improve safety? And I would love if we have a moment to turn it over to Kwaniqua to hear a little bit about how this fits with the Cities United approach.
Oh, thank you. And Cass, you were hitting it right on the head, right? All of those are these areas that we uplift quite a bit. So when I think about and talk about interrupting the cycle of community violence, the credible messengers are those that we go to, quite frankly. There are a number of them across the country that are doing phenomenal work from inside of the hospital, right, to directly within our community. So if you're not as familiar with those particular methods, I encourage us all to look up and learn more about Cure Violence, right? The HAVI, or the Hospital Alliance of Violence Interruption. Right? So there's a number of national and local and place-based organizations that are doing just that. But more importantly, there are communities that have been doing that for years, decades, with very little funding, very little support. And very little opportunities at times for really wraparound services that we know it takes to actually reduce the number of people that are getting shot, right? And so hands down, the interrupting work is important, but we also then can't forget about that long-term approach when we think about those policies that have created conditions for those environments to live, right? So hands down, again, we disrupt those systems of inequity, right? And so education, health, right, mental health as well, right? So we want to be very clear that all of those systems have a role to play as well.
Yeah, thanks, Kwaniqua, for that. And certainly that hits on your 3 points of interrupting, dismantling, and then investing as we think about what happens in communities. I want to jump back to Ari for a question. What was the motivation for doing this report? Why was it important for us and is important for us to understand this data?
So, I mean, in public health, the first step is really understanding what the scope of a problem is. And so if you don't have, data and looking at the nuances of who's impacted by a public health crisis in this case, then it's hard to develop effective solutions. And so this is, again, just one aspect of looking at the important data of gun fatalities, but to really understand this public health crisis, we need to be developing more reports like this, more research on gun injuries and who's impacted, because again, that's the first step of a public health approach, right? From there, you can look at, okay, what are the risk factors? What are the protective factors? How do we develop and test potential policy and programmatic solutions And then how do we evaluate those? And so that's kind of the way that we've tackled a lot of different public health crises in this country. But the challenge with gun violence is in the past, there's been such little research on gun violence in comparison to the scope of the burden that it places on our country. And so that, again, is why we need more research, more funding for research to really understand this problem, because this is just the beginning in terms of really understanding the crisis of gun violence.
I wonder, Cass, if you have any comments to that, and if you can speak to the lag in getting the data and the importance of having timely data.
Yeah, thank you. Ari, I agree with all of the points that he just laid out, and I would simply add, it's May of 2022, and we're talking about data from 2020. It's great that we're looking at this. We need to, even in an issue as important as gun violence prevention, to be doing some of this basic descriptive work, because we've had gaps in our understanding for so long. So we need to be doing this. But it would be great if we could be a little bit more timely. To Ari's point about evaluating what's working, it's important for us to know, as we are making changes, implementing new programs, new policies, what's happening. And that's a little bit harder to do on a larger scale when we have such a substantial lag in data. And I know that there are efforts being made to improve the timeliness, but I would just say that we need to invest in the infrastructure to make sure that we have data that's coming much more quickly. I learned recently that there's a website you can go to figure out how many animals were slaughtered every day, how many pigs every day are slaughtered, but we are a 2-year lag for gun homicides of people in the US.
Yeah, thank you for that. I'm going to jump to the chat here where I see more questions are coming in. For Lisa, the report provides a brief overview of some policy and program solutions for addressing violence. What data do we have on the effectiveness of these strategies?
That's a great question. And it's important that we as researchers and advocates are only supporting policies and talking about policies that are really evidence-based. We don't want to tell the public that something is definitely going to work. If it's not, that all being said, we don't know that everything is going to absolutely work, but we do have good evidence on a number of these policies that we have put in this report. So for licensing, for example, I mentioned that was one of the policies where we have the most research showing that it is associated with significant reductions in firearm homicides and firearm suicides. Specifically within firearm homicides, we know that states with strong handgun purchaser licensing laws had fewer fatal mass shootings and fewer fatal mass shooting victims, so victims and incidents of fatal mass shootings. When we look at Connecticut specifically, their purchaser licensing law was associated with a 28% reduction in firearm homicides, and firearm suicides reduced by 33% over the study period that I believe Cass and others at our center did this research. So we know licensing is certainly a policy that is strongly backed by evidence. I won't probably have time to get into all of these, but domestic violence protection orders, extreme risk protection orders as well. There is data to support their effectiveness, specifically domestic violence protection orders. We know that when they require firearm removal, there is an associated 12% reduction in intimate partner homicides. And we know from preliminary data on extreme risk protection orders, these are newer policies. So I would say the evidence is convincing. It's not settled at this point. We still need much more research on extreme risk protection orders, but a study of Connecticut's extreme risk protection order found that for about every 10 to 20 firearm removal laws, there was one life saved. So I would just give the caveat that with extreme risk protection orders, we do need more research there, but it is convincing at this point.
I want to stay on that for a moment as questions are coming in about the comparison of data. So for Ari or Lisa, there are a few questions, right, as it relates to comparing Mississippi to Hawaii, and more generally about state data. Is there a deft comparison with a non-island state with strong gun laws with respect to Mississippi?
Yeah, I saw that question. Can I'm going to share my screen real quick just to show we have a really nice, or designer made a really nice graphic of the state variation. I think it's really helpful. So I'm going to show that real quickly. So you can see, yeah, we looked at, in that fast fact that I mentioned, comparing Mississippi to Hawaii, we just took the highest state with the highest gun death rate, compared it to the lowest. But if you can look, and you can see, as Cass mentioned, the states that are topping that list are southern states that tend to have weak gun violence prevention laws. And then you have the Mountain West as well, I guess, Wyoming, Alaska, New Mexico, and in Montana. But if you're looking at the states that have the lowest gun death rates, it again is a lot of states that have firearms licensing, that have ERPO and strong domestic violence protection orders. So I think this is a helpful graphic to look at it. And again, something that Cass mentioned is like some of the states that we hear about in the media, and so the cities that we hear about in the media all the time, are in the middle of the list, right? I mean, hear a lot about New York and violence in New York City, but overall, the gun death rate is actually the fifth lowest, right? So I think this is helps to contextualize that. I don't know if Lisa or Cassie, you want to jump in.
If I could just jump in briefly, I would add many of the states that have these stronger gun-related policies also tend to have community-based violence prevention programs or offices of violence prevention. So it's not just a policy focus. It's about investing in people, places, and communities that disproportionately experience rates of gun homicide, for example, and trying to address some of those structural conditions that contribute to those higher rates. So it's not just a difference in policy, although that is something that was highlighted. It's also about investment at the state level and the local level for these community-based violence prevention programs.
Cass, thank you for raising the issue that it's not just policy that's needed, but these other elements, including structural and social as well. I would love to hear your thoughts on why, however, it's so difficult for some states to implement stronger gun laws.
I think based on some of the work that we've done in our center, some of the work led by Dr. Colleen Berry and others with our public opinion polling data, we know that there is very broad public support for many of the policies and programs that we've been talking about today, talked about in the report, and some of the things that Quiniqua also raised in terms of the roadmap for addressing this issue. The problem sometimes translates into a difference in activation, and in terms of people showing up to do something. Someone can have support for a thing, but how deeply do they feel it that will lead them to act in a particular way? And we found very, very broad support, more than 80% support, for example, for background checks for all gun sales, over 75% support for ERPO, very broad support for community-based violence prevention programs and hospital-based violence intervention programs. The challenge is that until perhaps the Parkland shooting, maybe before with the Sandy Hook shooting, folks didn't necessarily call their legislators because of an interest in gun policy. People were rarely single issue voters on guns unless they were on the side of gun rights. And that difference in activation, the ability of gun rights groups to be able to motivate and activate their base to call, to show up, to vote, has been different. And I'm excited to see some of that changing. But I think we also need to think about how we are meeting people where they are in terms of understanding the benefits and potential barriers for some of these policies. We can't just be telling people what they should be doing. We need to engage with people who own firearms, who are versed in gun culture, understand what the concerns are so that we can, just like we would with community-based solutions, can we co-create policies that are respectful of the current Second Amendment right to own a firearm, but also can be beneficial for public safety. We really have to engage everybody in that conversation.
Yeah, absolutely. I think it goes back to what Quiniqua said about the full range of engagement and stakeholders, from those at the community to those who are in government and policymakers. I want Cass to throw this question to you, or Ari, or Lisa, or Quiniqua, any of our panelists. Does the data make a distinction between different types of gun-related deaths? For example, and this is the question from the chat, for example, police shootings or self-defense. What type of gun-related deaths did you analyze?
So maybe I can speak very quickly, and then I'll turn it over to Lisa or Ari. So we looked at all outcomes, all fatalities. I know that there was a question in the chat about justifiable shootings or shootings by police, and I just wanted to say two quick things, and then I'll turn it over. We tend to not use death certificate data, which is what we analyzed here, for shootings by police, because there is bias in who gets listed as police-involved shooting on the death certificate. If you look at CDC data, these death certificate data, you might see between 400 and 500 per year. But if you look at better sources of data, you see maybe 1,100. And so CDC doesn't break that down in this particular data set, but there's other data that you can get. UCR tracks justifiable shootings, but there are issues with reporting for that data because it's a voluntary system, and there's reasons and times why states don't report into that system. And so those numbers are perhaps not quite as comparable as these are. Ari, Lisa, I don't know if you want to jump in.
I would add one question I saw in the chat specifically asking about what % of these deaths were domestic violence homicides. And I would just say that we don't know that, and that's a problem. We don't have good data on domestic violence homicides in general. We have some data from the FBI that's a few years old at this point. We know there's a study that found that about 1 in 4 homicides are related to domestic violence. But again, we don't know specifically when looking at this data of the homicides in 2020, what % of them were related to domestic violence. But as Cass said, we do know that there was a 50% increase in the number of homicides among Black women. That's incredibly problematic, incredibly troubling. And we know that Black women are disproportionately impacted by domestic violence homicide. I think we need more research into what impact COVID has had and the stay-at-home orders in 2020 had on the increase in domestic violence. There has been some research on that, but I would love to be better able to answer that question in my advocacy and research work. And unfortunately, we don't have the answer to that right now.
Thank you. As we noted earlier on, the data is available. There's a lag in data, and yet there's still opportunities for the types of data that is needed to be collected and reviewed for really making an impact, a public health impact in this area of violence and gun violence specifically. Another question from the chat for any of our panelists notes clearance rates for shootings, in particular non-fatal shootings, are remarkably low in many jurisdictions, with some law enforcement agencies solving less than 10% of non-fatal shootings. How important do you think addressing these issues are in terms of reducing overall levels of gun violence?
I'll start and then I'll turn it over to other folks if that's okay. Yeah, I mean, I think this ties back to one of our recommendations, which is the community violence intervention and homicide review commissions, right? Because there is, the homicide clearance rates across the country were, around 50%. And then for non-fatal shootings, like they said, it's a small fraction are solved, right? And I think part of that is lack of trust and cooperation with law enforcement, and it goes both ways, right? The community doesn't trust law enforcement because of very real things that have happened, very real discriminatory policies that have been in place. But then at the same time, law enforcement isn't working closely with the community. So I think homicide reviews are a great way to bring those, community together. One thing I was going to say is that there was a study in Milwaukee that I thought was really interesting. This is a while back, but there was a case of police brutality, and the researcher looked at after that happened, he looked at 911 calls, and there was a huge decrease in 911 calls to report crime. And so when the community doesn't, and then later there was a large increase in gun violence, right? So when the community doesn't trust law enforcement and isn't willing to report, crimes within their community, then you have rates of gun violence kind of spiral out of control. And I thought that was a really interesting study that just kind of directly showed that, distrust, police brutality leads to distrust with law enforcement, which leads to, low clearance rates and spiraling of violence. But yeah, Cass and Lisa, I don't know if you want to jump in.
I'd like to jump in on this one as well, because it's extremely important that we do pay attention to this. As Ari uplifted a lot of the causes, what I want to lift up now are a lot of what happens right after that, right? So that a lot of non-fatal shootings leads to an increase in other shootings, right? Or aggravated assaults, right? So we will see these show up elsewhere, even if it is not showing up in the clearance rates, particularly. And it's really important that we lift this particular data up a little bit more, right? So folks can understand it and learn more about it, so that we can pay attention to what happens after the fact. Because we do know, and we started off this conversation with those who are having gunshots that are non-fatal, retaliation is higher, right? But then also lower rates as we think about self-esteem and how people feel about themselves and their lives, and the impacts that that also then has on their communities. Once someone is impacted by a gunshot, even if it is low rates, we know that it's highly important to keep having and digging through the reasonings and the rationale behind it, so that we can decrease the numbers on the front end, prevent a lot of retaliation, but then also just keep funding these programs and strategies, we can't stress that enough, that actually do get to those individuals, because at times community outreach, community interrupters, or just community leaders, right, where they are showing up at people's houses and on doorsteps in faith communities as well, and so they are showing up in other places.
Lisa, let me jump in here with and Kuniko, thank you for that. Lisa, here's a question. What resources are available to help policymakers set up effective HRCs and CVI programs?
Great, another great question. And Ari, Kuniko, Cass, feel free to jump in here, because I've been trying to read through the chat. There's been a lot of questions about translating this research to policymakers, and that's really what we're here to do. So please also reach out after this webinar if you have more questions. I would say, and I'll try to answer a couple of the other questions in the chat while I'm at it, about challenges for passing this type of legislation or setting up these types of offices in states that may not have legislatures that are receptive to gun violence prevention policies. And I would just say that that is unfortunately the reality in a lot of states, but that doesn't mean that that can't change. There's a number of examples we've seen. For example, in Virginia, over the past decade, we have been working on several evidence-based policies in the state of Virginia that sometimes took 4, 5, 6, 7 years to enact into law. And so I would say is keep leading with the evidence for all these policies, for HRCs, for CVIs, come prepared with the facts, with the reasons behind why these policies or offices are important, and also make the case in terms of public health and prevention. There's some questions in the chat about financial costs related to gun violence. There is a really strong case to be made that by focusing on prevention, we can save states and the federal government so much money. The economic cost of gun violence is enormous. We can provide those resources. I know Ari and I have a number of resources on what gun violence costs states and the federal government in terms of, the direct care to get someone treated for a gunshot, in terms of getting an ambulance to a scene, and all those costs that go into the cost of gun violence, not to mention the years of potential life loss for someone who dies from gun violence, not to mention the work that they can't do if they suffer a lifelong gun injury. All of those contribute to the economic costs associated with gun violence. So lead with the evidence. We have some of this evidence in our report, but we have a lot more research and data to back these policies. Ask us questions. We're happy to provide support when you're looking to pass these policies or set up these offices in your state, and just really make the case for why this is the right approach, why it is going to save your state money, and why it's going to save lives, of course.
Thank you for that. And I would just add, in terms of not only the years of life lost for that individual, but certainly the impact to community overall. We have 4 minutes left, and I wonder, I'm going to see if I can pull a question here from the chat. Kuniko, one of the things that I know you talked about is that we understand the what, but what about the why? Why is this critically important? Why are we here? Maybe you can just kick us off with the why, and I'm going to find one more question in the chat here that will bring us home.
Yes, the why question is always complex, right? Because it's deeply personal, right, to each person, right? So the why is this important to us? It's because we matter, right? We all do, each and every single one of us, every single person who has died to gun violence, every single person who has gotten a gunshot wound in their families and their communities. And if you believe in 6 degrees of separation or not, we are all connected to one another in some way or the other. And so when we lose people to gun violence, we are losing pieces of our community that we can never get back. And so, of course, that's a very deeply personal reason for a lot of people. We could talk about the data, we can look at the numbers and do all of that, but ultimately, when we lose people to gun violence, we are losing pieces of our community and therefore pieces of ourselves. And so this one is always a challenging question, Michelle, because it's so very, very personal, and tears typically come to my eyes when having this discussion.
Yeah.
If I could just jump in, maybe we can all share a little reflection on the why, because it really was impactful to me hearing Quaniqua's perspective on this. And for me, as a gun owner, it's important to me that we have good data and that we are engaging all perspectives to make sure that we can take a harm reduction approach and really use those effective public health strategies and tools to address this problem. We've spent decades trying to arrest our way out of a violence problem and have not been successful. We've spent decades, if not centuries, with a stigma problem related to suicide, and that hasn't helped us either. So we need to really think about shining a light on this data, engaging everyone from impacted communities with regard to non-fatal shooting and homicide, veteran populations, gun owners, folks who may be at greater risk of suicide, and bringing everyone together to think about what are some strategies that we can meet people where they are that are going to be respectful of why people might own firearms, why they might want them, so that we can try to address this problem together as a whole community.
Yeah. Thanks for that, Cass. I have one more question in the chat in the final minute that we're remaining. So related to the data question, are there national standards that states follow for collecting and reporting gun violence data? And is that data readily available to the public?
Sorry, I couldn't get my off of mute. Oh, sorry, go ahead, Lisa.
No, I was going to talk specifically about the data that we used for this report, but I'll let Ari, as the lead author of the report, take us home.
Okay. Yeah, so the data that we used is publicly available. The CDC makes it available through their Wonder database, and they also have another database called Whiskers, which is it takes a little bit of time to get used to, but it is fairly user friendly in terms of pulling different demographic data. But yeah, it's severely, I mean, we touched on this earlier during this discussion, but the data that we have is delayed and fairly limited, right? We're looking at just gun fatalities, and we need more data about different types of gun violence, about the situation, more context of each situation that can help us inform policy and programs and have us produce better research. But yeah, this data is from the CDC is really helpful in terms of just getting an overview of gun deaths, and it's the most comprehensive. So you can pull data from the FBI, UCR, the FBI's database, but this is much more comprehensive because again, it's death certificates and it includes suicides.
Well, thanks, Ari, and thanks to you, Cass and Quaniqua and Lisa, and thanks to all of you in our audience for joining today as we again think about how to address this critically important issue as it relates to gun violence, death across our country. Stay tuned for more programming from the office and from the center, and we look forward to joining you in the future. Again, our report, there is a link to that report. I know that there were questions about it, and we will certainly get that out to the participants here as well. Thank you again for joining us, and thank you panelists for being here.